Okay, so welcome to the Wayne County Health Catalyst for COVID Care. We're going to do some introductions in a moment, but we'll start with our pre-survey. If you want to scan this QR code, you can, Reem, or there is a link in the chat. Thank you, Maya. And we'll get back to recording in a few minutes after we've gotten everyone in and done the session evaluation. All right, so welcome back. If you're still joining us, welcome. We are going to go ahead and get started with introductions. I'm Dr. Carolyn Custer, aka Dr. C. I'm the project director for the health literacy training portion of this grant. So the Wayne County grant, you're from Access, right, Reem? I don't know if you're. Nope, I think we might have lost you. So some of the partners, I think you're from Access, if you're still connected. Access is one of them, Chaz. And what we're trying to do is teach people about health literacy and communication and working towards vaccination, right? So this is about COVID, but we're going to kind of make it a more broad, in a broader sense about vaccinations. So I'll go ahead and hand it off to Maya.
Perfect, thank you. My name is Maya Thompson. I am the Member Services Specialist with MISHWA, and I am CHES certified, so that is Certified Health Education Specialist. It's very similar to the CHW certification, but it's more focused on program planning, assessing needs and capacity, and evaluation and research portion of community health. So very much providing the programs to those community health workers to use on the ground.
Thanks, Maya. So Reem, as we get started, I'm going to review the agenda. I just wanted to quickly say that this is a really engaging. We try to ask you questions and engage you. Right now it's just you, but if we have a discussion almost, that would be great. So our agenda for today, we're going to talk about what it is, health literacy. We'll talk about some strategies to increase health literacy, take a quick break, and then we'll talk about vaccine hesitancy. And like it says at the bottom, we want your input. The learning objectives, of course, describing health literacy as a determinant of health, and then coming up and identifying strategies to address health literacy. So culturally and linguistically appropriate services or class standards, and cultural competence. Those are some of the things we'll talk about today. And then, of course, understanding vaccine hesitancy. So if you're there, Reem, have you seen this picture before?
No, I have not.
Okay, good. Thank you for confirming you're there. Excuse me. So we can't talk about health literacy without starting with health equity. Okay, and so this picture, a lot of people have seen this picture. It's a representation of the difference between equality and equity, and we're going to go a little bit further. But you'll see on the picture on the left, equality, everyone's getting the same box. Although everyone has the same box, not everyone has the right outcome, right? The outcome of being able to see the game. Equity is where everyone is treated fair and impartially to get the desired outcome. So you can see the shorter person got 2 boxes. And so when we talk about health equity, what we're talking about is everyone, right? Everyone has a fair and just opportunity to be healthy. And that's what we're talking about, health and wellness. This image takes it one step further. So this is kind of showing the idea of justice or social justice, right? The things that we work for. And of course, equity is giving people fair and impartial what they need. But what if we got rid of the barrier in the first place? So justice is talking about redesigning our systems and doing work to take the barriers out so everyone can see the game now because the cause of the inequity was removed. This is the Giving Tree is a great book. And again, this is just another example of inequality versus equality versus equity and justice. Hi, thanks for joining. Can you hear us now? Is it Aaliyah? Okay, we'll just keep going. So as community health workers, we talk a lot about social determinants of health. And so health literacy is one of these social determinants. And so what we're talking about are the different things related to our environment or related, to our access and whatnot, things that make an impact on our health, but maybe aren't necessarily related to getting healthcare in the office, right? So they actually say only about 20% of your healthcare actually happens in the office with the doctor or the provider. It's everything else about your life that can really impact health. So things like access to healthy food, etc., education. All right. Are you both able to hear us? Sorry, it's hard with you not on camera.
Yeah, but for some reason she can't press her mute. I think she just sent a message too.
Oh, okay. Well, then I'll have Maya. I'm sorry, Maya. It's just, I don't know why I'm doing that, but
You're fine.
Maya will monitor the chat. Aaliyah, we want this to be engaging and interactive. So if you have any thoughts or comments or questions, please put it in the chat. And Reem, just interrupt.
Okay.
Okay, so we started with talking about health equity and social determinants. So we move on to this idea of health disparities, and we talk a lot about this, right? But the definition is really preventable difference in the burden of disease, in violence, injury, opportunities to obtain optimal health. And so these are things that exist because of health inequities and factors like social determinants of health. For example, you may see that people in minority of color population may have a higher prevalence of diabetes, right? Well, at the end of the day, we look at, well, why is that? Let's say versus a group of white people, because maybe it's related to access to insulin, transportation to the doctor. So we're talking about different barriers to health that cause outcome disparities. And systems designed with structural racism. You can put it in the chat if you know, Leo, but do either of you know what redlining means? Or have you heard the term redlining before?
No, I did not.
Okay. So this is actually a map of Detroit, right? And this line right here represents the red line that was established in 1939. So in 1939, there was a law passed that said, basically people outside of these neighborhoods have to be white, right? So it's a discriminatory line. And what it did was it allowed, so people outside in the suburbs were starting to get mortgages and moving out to the suburbs and whatnot. And people in the city were not offered those same opportunities. So that's the beginning, and it's crazy because it's a policy almost 100 years ago, but it still impacts everything that we do in health. And so because of that, there's a history of a lack of healthcare for certain populations and access to education. And all of these things together make up, health literacy and the basis for understanding health. So I'm going to pass it on to Maya now. If you guys have any questions, please, like I said, interrupt us.
Absolutely, thank you. So we're going to get into that health literacy portion and what health literacy means. So we want to do a little bit of a review of what health literacy means to you and what your current knowledge of what health literacy is. So if you want to drop it in the chat or come off mute and let us know what health literacy means to you.
Well, for me, health literacy is basically for like the clients or the person you're serving, if they, answering the majority of questions, providing them like resources for them to get the help that they're asking for. But mostly just like explaining a lot just for them to basically understand the concept that they're asking help for.
So there's a couple different portions to health literacy. The first one is personal health literacy. So it's the degree to which individuals or clients, patients have the ability to find, understand, and use the information and services to inform them to make health-related decisions and actions. And she put in the chat, I think health literacy means to help individuals with the ability to understand health-related information. Perfect. I'm going to pass it on over to Dr. C. She's going to talk a little bit about Healthy People 2030.
Thanks, Maya. So Healthy People is a report that comes out, kind of sets some goals for the health of the nation. Every 10 years, there's a report. And we bring this up because in the past, personal health literacy was a goal in 2010 and 2020. But in 2030, we had a change. We added organizational health literacy. So we come to an understanding that it's not just about people understanding. We, as providers and healthcare, provision providers, we have to be able to explain things in a way and communicate things in a way that makes it equitable so people have this access to information and they can be healthy. So a lot of what we're going to talk about today is that organizational health literacy, and I'll pass it back.
Thank you. So we're going to discuss a little bit about the components of health literacy. So the first one is the different skills and knowledge needed to interpret health information that's being given out. And different skills and knowledge, one is literacy and one is numeracy. So literacy is the reading, writing, basic math, speech, and comprehension skills. And then numeracy is understanding how math is used in a real world setting and the person being able to apply it to the best to make the best possible decisions. And then the other component would be factors that impact health literacy. So there's complexity of the health information that's being given out, the language that's being used, the age of the person that you're giving it to, their state of health. So if they have different illnesses or anxiety, their cultural background and cultural beliefs impact it. And then the big one is the way health information is communicated by health providers. So making sure that we're doing what we can as providers to be able to properly communicate health information. And then this is kind of a diagram that shows the same thing as before with those individual factors, and then there's those system factors that play into health literacy. So a couple impacts of limited health literacy. So people with limited health literacy are less likely to use preventative health services. So things like pap smears, mammograms, colonoscopies, vaccines. They're also less likely to manage their chronic diseases. They're more likely to have poor medication adherence. They typically have higher rates of hospitalization and using emergency services, have higher mortality rates, and then one that we want to highlight is they report a sense of shame about their health literacy. And then it is also typically associated with higher health costs. Then continuing on with that, some of the impacts of communities having limited health literacy is that there's missed opportunities for services, such as free vaccine clinics or free preventative screenings. There's lack of preparation for emergencies, so severe weather, evacuations, missed warnings about environmental health, such as contaminated water, and misunderstandings about public health warnings about food safety, so any recalls or anything like that. So if we look at the average reading level of adults, it is a typical 8th to 9th grade reading level, but we see most health education materials that are dispersed is at a 10th grade level or higher. So in order to be most inclusive, we are wanting to make sure the reading level of the materials that we're putting out to clients and patients is at a 5th grade to 6th grade reading level. And there are multiple different resources that you can use to check that to make sure we're at that reading level. And then there's a couple red flags for low literacy. So this is what you're going to want to be looking for in patients and clients that you're working with to kind of scan and see what their health literacy is. So if they're frequently missing appointments, not completing registration forms all the way, they're not compliant with their medications, or they're not able to name their medications, they're not able to give a full history, and they don't follow through on test referrals. And one of the biggest ones that people notice a lot is they don't ask as many questions. One, because of that shame, and two, also they might not know what questions to ask.
All right, thanks, Maya. So we're going to talk briefly about a universal precautions approach. Do you guys know about bloodborne pathogens and PPE? I feel like everyone in healthcare should know about bloodborne pathogens.
Yeah, is it letting me talk now? Sorry.
Yes, yeah.
Yeah, I'm very familiar with it because
Nice.
I took a nutrition course and when I went to university,
Okay.
so that's something we learned about.
Oh, great. Okay, so we're going to talk about health literacy, just like we talk about bloodborne pathogens. So, you know, HIV, hepatitis, etc. You can't look at someone and tell, right, if they have any of those bloodborne diseases. So what do? We treat all bodily fluids as if they have disease, right? And so we use precautions. We put gloves on before we touch blood. You know, we have the eye shields if there's, you know, fluids coming out. So in a similar way that we just assume that everyone has a bloodborne pathogen, so we use safety, we can do the same thing with health literacy. And it's really, really true. You cannot look at someone based on their job or even their level of education and say they're a health literate person. It's not something you can do. So by using a universal precautions approach, we just assume everybody has difficulty understanding, and then that forces us, right, to communicate in ways that people can understand better. And that's what we're going to talk about with these 5 health literacy, well, 6 technically, the health literacy interventions that we will go over. And of course, our goals to simplify communication, confirm comprehension, and it helps support patients, it makes things easier to navigate and makes it easier to improve your health. Okay, this is a slide showing what a health literate organization looks like. I'm not going to read through everything, but just to note, making sure that that we're communicating properly and clearly and using good materials and, you know, teaching our patients, that is something that has to be prioritized throughout the whole organization to really work, right? So, you know, how does the president, CEO feel that? How does the executive team should come down all the way through? When you're developing materials, you're thinking about health literacy. When you're talking to patients, you're thinking about how you can be health literate. So this is just kind of what it looks like to have things in place. All right, so our first turn to share. Go ahead, Maya.
So as we mentioned, we want it to be interactive. So if you guys ever have a time that health literacy has impacted you or a loved one's ability to be healthy, that would be great. We can just kind of have a discussion.
Well, I can start. My dad's like diabetic and he's been diabetic his whole life. Um, so he's like that person, he's always been like scared to go to the doctor and get checkups. So he didn't like he didn't get checkups until now, like after a couple years. He kept like ignoring it and he actually didn't know like the issues with his health and how bad it was until he got a checkup and he did recently like a year ago he had a stroke and that actually opened his mind to frequently like go ask questions and you know do blood work and you know take care of his health. But throughout the years he'd always ignore it and he'd always have like you know poor health education. He never understood why I need to take care of my health or why I need to go get a checkup or why he needs to go to the doctor. But now he understands. Like he is more better educated now.
Mhm.
And um you know throughout the years he had like very low health literacy.
Wow, thank you for sharing.
My mute button is working now. It just stops working.
Okay. Do you have
Do you have anything you want to share?
Yeah, sure. Well, I actually experienced it with one of my clients that came from overseas. So their education wasn't too high, and they had like a heart attack, and they needed you know to apply for all this medical help, and they just did not know. So it affected the whole family. Like till this day, they are affected by this cause because they never asked for help or didn't know where to go to apply for, like, let's say for insurance, for Medicaid or all these type of insurance. So they had a very hard time in their life, and he barely made it.
Wow. And Aliyah, what you said about your dad, it's so true. A lot of times we don't care, we don't, think about it until something happens, right?
Exactly. Same with Reem too. I had a client that had cancer. And he neglected like getting health insurance and getting checked up until like it was like too late.
Mm.
So I did apply for him like for health insurance. He did get it, which is a good thing. But he just waited too long to
Yeah.
apply and get checkups. And it's sad that many people like just neglect their health like this. I think a lot of people need a better understanding of like health education and all these informations that we can provide them.
Oftentimes it's hard to know, the patients don't really know where to turn to or what to go to, so they just don't do
Exactly.
it. So having resources available to them that they are able to use and utilize is extremely important.
Exactly. And we have like we are a nonprofit organization and we have these resources to help. But it's just like these many people don't have this information or aren't educated. So they don't turn to these resources.
Mm. So, of course, you guys are young, so I'm going to use this as a pitch. You as a community health worker and a member of the community that you're in can serve as a champion, right? To
Yeah.
promote health and talk about it and start conversations. Okay, thank you both for sharing. Let's keep going.
Of course.
Alrighty, so we're going to be talking about some interventions that we can use as providers, as CHWs, to help overcome those low health literacy rates. So we're going to review some evidence-based interventions and strategies that you can use to increase personal and organizational health literacy levels, and then they can be used to create a more health literate environment.
All right.
So a couple strategies here. The first one is clear communication. So making sure you're greeting clients warmly, making eye contact, listening carefully, not using super heavy medical jargon. You're using the same words that clients are using, so that makes sure that they can understand you. You're slowing down, you're limiting the amount of content that you're giving them, but you're also repeating the content that is super important. You're being super specific, showing graphics, demonstrating how certain things are done if it calls for it. You're inviting the client participation to help maybe have them show you what you're trying to instruct them to do, and then encourage questions constantly. So there's a couple different things to consider when communicating about health. So I'm not going to go through every single one, but make sure you're following 7 of these things. So the trust, making sure that people are going to trust it. Is it enough information? How relevant is the information? What are the conditions that are around the audience that you're talking to? What's their ability to act on the information? What are they going to think about that information? And how are they going to respond to it?
Yep. So anytime you're planning a health campaign, like I feel like a broken record here, pull this slide out and answer these questions and make sure that you're, planning your campaign correctly. All right, so something,
is this you?
Sorry,
Good.
mailman.
It is you. It is you. You're good.
I'm taking over. So something we talk a lot about, right, is using plain language. And I'm sure both of you work in Access is a social service organization, so I'm sure that some of this you've heard before. But of course, we don't want to use big words like hypertension. We'd rather use things like high blood pressure. One of the things that we talk about on this list a lot is the word diet. Because a lot of times when you ask people, well, what is your diet? they might think you're mean like Weight Watchers or, Atkins or some sort of diet plan where they're losing weight. But what we really want to know is just, what are you eating? So, it's better to use the saying, tell me what you eat during the day rather than what is your diet. Of course, things like hyperglycemia, myocardial infarction, just using that plain language, it's really important. And going along with that, during the height of COVID, we had a screening fair, and one of the tests came back positive. And we're putting on a piece of paper, like you're positive, negative, and giving it to people. And they thought that positive was a good thing because typically when someone's positive, they're good, right? That's a good thing. But in this case, positive means you have COVID. So what we ended up doing was changing what we were writing on the form to say, you have COVID or you do not have COVID. So we recognized that there was an issue with the word, and we changed how we were presenting the information. Okay. I'm like, this is still me. All right, so we talk about clear communication using plain language, using a good, warm, tone, greeting, etc. The next thing that we're going to talk about are using effective health education materials. So this is going to be kind of a fun section, I think, but some tips, right? We have all these handouts, all these flyers. Are they good? Are they usable? So we just have to make sure, are they easy to read? We talked about readability and aiming for a 5th to 6th grade reading level. We'll talk a little bit more about that. Is the purpose of the material clear, right? Does the handout, is it clear, or is there like so much information it doesn't make sense? Like I just said, avoiding those medical terms, using common language, breaking the material up into chunks to make it easier to understand, right? If you look at a flyer and it's just all words, it's like, wow, where do I start, right? So we want to make sure that the material is kind of chunked up. A good flyer will actually have an action item. So it's not just talking, saying, hey, you can take this next step. Uses visual aids effectively, different, pictures, colors, charts, etc. But also be aware of confusing numbers. We don't need to talk statistics or numbers like that with people. We just give them the information. So what we're going to do now is flip it over to you, and we're going to present some COVID-related health education materials and have you tell us what you think. So if you want to come off mute, you can. I hope you're able to see this. So the first slide shows 3 flyers, and they're about children getting vaccinated. The one on the left is MDHHS. The one on the right is the CDC. And the one in the middle is a flyer that Authority Health put out in Detroit. So just looking at these 3 and thinking about kind of what we've talked about, which one do you think, and there's no right or wrong answer, what works and what doesn't work with these? Which one do you like the most? Do you think is the clearest?
I honestly like the bear. Just catches the eye.
Right. So this
Yeah.
message, let's read this message. Keep your cubs safe. Everyone knows what that means, right?
Yep.
Okay, so this one has a very clear message. What about this one? Keep the school year fun going.
Yeah, I was gonna say I like that one because you just see like all these pictures of the people, like they're happy and they're
And the Band-Aid.
smiling. And I don't know, it makes you want to go get a vaccine.
Now, the difference is here, what do you do next? Is there any action? I mean, they do provide a website.
They do provide a website.
And like the picture that I was talking about, the bear, it has like also a number that
Yeah.
sticks out too.
Yeah, so it's so I guess that's a website to schedule to get
Yeah,
a
I'm
vaccine.
not sure. Yeah.
Yeah.
I'm not sure.
What about this one?
The pretty girl gives it too. Like
Yeah,
it
just that
out.
smile.
Mm-hmm.
What about the words?
Has more information. I can
It
tell
says
you
like
that.
get ready for school too. So that catches the
Yeah.
eye as well.
Okay, so get ready for school. That's a good message.
Mm-hmm.
Do you think so let's think about it as far as your clients that you serve. Do you think something, like, let's say it was translated, if they spoke a different language,
Yeah.
would something with a bunch of words work? Do people read this?
And to be honest with you, for me, I feel like when there's images, that's what catches the clients, even if like
Yeah.
they have children or not, but it catches their eye more when they see a picture or an image of something rather than them, reading those little paragraphs or something. Because when they see that picture, they'll, oh, okay, let me actually read now because I'm interested.
Mhm.
I
You
feel
know?
like if it's like a sentence or two, yeah, but if it's like
Yeah,
a paragraph, no, I don't think they'll actually read it.
yeah.
Those are great thoughts. All right, let's move on to our next slide. All right, so MDHHS put this out to try to, not try, but to try to alleviate people's concerns. Remember, the vaccine came out pretty fast, and people didn't trust how fast it came out. And so they put this ad out, and they did it in all different languages, and it was always this person in the middle, this family. Would this work for your clients? Let's say, translated things like decades of research, volunteers, clinical trials, scientists, and doctors. What do you think about this advertisement, and would it work for the people that you serve? Do you think? Would this change anyone's mind?
I mean, I think it would. I think it's an effective, like I said, it catches the eye. And then when they do read it, I really think they're going to be interested in doing all this stuff, especially like if they want to volunteer and all that stuff. Um, yeah, I think this is like a good source to start somewhere or like for them to gain more information.
Okay. So if you had a patient with you and you handed them this, what do you think would happen?
I honestly think they would, can like read more and be interested. And especially like when there's like the websites, I feel like a lot of my clients love to do research, to do more research, like to go on their website and to like to read more about what they're trying to say, not just the actual flyer. That's my previous experience I had with one of my clients. There was something going on in Access and there was a flyer and then they had this link. So he told me, I want to go into that link and then read more and to see what's, what they have to offer or what's going on exactly. So
That's great. And we all have different populations that we're serving. So it's good feedback to hear that in your instance, websites are somewhat effective, at least for some of the people that you've served.
I
yeah,
think those like bold letters really make it stand out because it says scientists have taken hundreds of steps. So like that does make it sound interesting to read more about COVID and the vaccine. Like Reem said, there was multiple clients that wanted more information about something. It's either insurance or something about their health. So just providing them a website to access, it really helps them read more about it and learn.
Yeah, that's great feedback. All right, we're going to move on to the next one. So most people don't like this one, just an FYI. A lot of people said, their clients this wouldn't convince them to do
I
anything.
mean, it doesn't stand out like the other ones, honestly, but
But either way, it's interesting to hear. We have not heard feedback, at least that I can recall, that people are actively looking on websites. And I think that's
Yeah.
great to know because like I said, I didn't know that. I mean, it makes sense, but we always assume I feel like we assume a lot that our patients don't have access to the internet or, stuff like that.
No, actually, I mean, I was surprised. Many do go on the website if you actually give them it.
Yeah. Okay, great. Okay. What time? Okay, we're gonna go through these. So there are 3 flyers in this next slide. The reason why I'm showing you these is because these flyers have what I would call complicated messaging. You see how there's different asterisks. So there's like an asterisk here and an asterisk here, and there's all this fine print. This is a message that could cause confusion because of those fine prints. And do you guys see kind of how I'm what I'm saying as far as like, let's say someone with a lower literacy level is looking at this, the Omicron bivalent booster dose, da 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 da. Would this confuse, or do you think?
I think honestly it would confuse clients because there's too much going on, too
Too
much
much.
words.
Yeah, I feel
Yeah.
like it's too much to read, honestly.
It's too
Yeah.
much, right?
Yeah,
Okay, so
yeah.
let's look at the next one. This one caused caused a lot of confusion. Even people were calling me and saying, you know, my daughter has COVID. She's on day 6 and her work wants her back, but she's, you know, feverish and coughing and I don't know what to tell her. And I said, if
Yeah.
you're symptomatic, you stay home.
You know what the issue is? It says may leave your house on day 6 to 10.
And
You have no
small-
symptoms or symptoms have improved. So that's the word may
yeah,
It might confuse some people.
yeah, it confuses many
Yeah.
But
people.
honestly, it's better than the other advertisement. It's a little bit more clear.
yeah,
Yeah.
I feel like when you have
It's-
not too much wording and then some images,
yeah,
it can help. Like you see how they have that house that says stay home.
Yeah,
yeah.
You know, this is like it's easier for the person to understand more or like to get it more. I mean, I understand like there's confusion where it says may and all that, but I feel like it's better than the other one.
Yeah. What about this one? This one was right in the beginning, mega COVID-19 plan. So kind of those big, like you said,
Hmm.
the big point.
um
Do we need all this fine print?
no, this is too much.
But you know, I think
Uh-uh.
they're trying to explain those bold
Yeah,
stuff.
yeah.
You get what I'm saying? So
Yeah,
I think for some people, like, they would be interested in reading like
the fine
um,
print.
the prints, the sentences, but
yeah, some
for
people read those
most,
bold ones and then they
for,
will ignore the rest.
for most, um, I don't think so.
It could have just been the big points
Yeah, yeah, yeah.
with a link, right? The link.
Yeah, exactly.
Okay, I'm gonna
Like
turn it over.
I think, yeah, if it was just like the bold, points and then like it took you to a link to read all that, then that would have been better.
I think this is good for people that don't have access to like going into the links, maybe.
Yeah, yeah,
So it helps them understand more without going in and doing their own research. Because some people, you know, it's hard for them to do that. So
okay.
it's a good and bad.
Everything has its pluses and
Yeah.
minuses, right?
Right.
All right, let's look at the next two with Maya.
Yeah, so the next two that we're gonna see, this is the one with the same information, correct?
Yeah, yeah.
Yes. So what would your clients or say about these? How do you feel about these ones? These are vaccinations for children.
I think this is actually good because like if you see like the one on the left, there's a picture of a person that's sick and then a person, you know, that's maybe I guess it's in the hospital.
Mhm.
So it gives a lot of information for them. It is a lot. It's like paragraphs, but at the same time, it gives detailed explanations with pictures. So I like it from my end, and also the one on the right, um, you know, also gives a lot of details with pictures. So I think my clients would actually like this, and they would read it, honestly.
And these,
I think it provides like a lot of information, but it is like very easy to read if you look at like the bold prints.
Mhm.
I think like if I gave it to my client, I think they would understand like what they're reading, as opposed to like the others, because the others didn't have much pictures.
Mhm.
So I actually really like this one.
Mhm. It is overwhelming, but it is
Yeah, it
chunky.
is overwhelming. I can see like if I gave this to my client, I can see them like asking me to explain
Yeah.
some portions of it.
Yeah, I mean, there are some sections, like if we look
Yeah.
at the part where it shows the multi-inflammatory syndrome in children,
Yeah.
a lot of that can possibly cause
Yeah,
some
yeah.
extra worry or confusion. So it's about addressing, you know, some of the situations in here of like, what is the reading level again? And is it
Yeah,
going to be
exactly.
something that people are going to be able to fully understand?
Or they'll need assistance from you. Okay, now look at this one and now look at this one. Better or worse?
Worse.
Why?
Because the other one, you know, the pictures were bigger, some words were bigger, so they really stood out. I feel
Mhm.
like this is all like the same font, kind of.
Yeah.
So it just doesn't stand out. Like those bold words don't stand out. So if my client were to read it, you know, they'd have a hard time understanding, like, you know, those main points.
Mhm.
Yeah, I don't think my clients will also like this because it's too much.
Yeah.
Mhm.
It's I mean it's like reading an article, and
Exactly.
I don't think that will be something they'll be interested in. They'll just say it's like it's too much going on, and like Alia said, there's nothing you know, bolded too much or nothing that shows, you know, like sticks to the eye. So I think this won't be good for my client.
Also, this doesn't have pictures. It has like less pictures. Only
Yeah,
on the top.
Yeah.
So that doesn't really stand out.
right, right. So the visual aids aren't helping
Yeah,
you.
it doesn't explain anything.
Unless someone likes to read a lot, you know, something different.
Yeah.
But even looking at these words, I see clinical trials, myocarditis, pericarditis, it's like febrile seizures,
It's just like very
a lot of medical.
small. I don't
Yeah.
know. It's just like the other one was like different fonts and it really stood out. Along with the pictures. Yep. See, like you see how there's like the pictures underneath the bolded terms.
Mhm.
It
Yeah.
really explains that.
Yeah.
So when a person looks at that, they understand what they're reading.
Mhm. Mhm.
This one's kind of hard to understand because there isn't like those bolded words, there isn't those pictures to explain. You know, not everyone's some are visual learners.
Right.
So
Right.
so the pictures really help.
Okay. So these are like the exact same thing. If you look, you'll see this point right here
Yeah.
is right here. So
But then look at the
interesting.
other one. It shows like a girl that's sick. So
Yeah.
when you look at that, you know you easily understand like you know
What's
that
yeah.
yeah what's going on. That girl has COVID. So the other one it just you know some people won't be able to understand
Too many
what
words.
they're reading. It's too hard to understand. Yeah.
All right, let's move on. What do you think
What do
about
you
this
think
one?
about,
Oh,
yeah,
sorry, Maya.
no, you're okay.
So what do you think about this? We have moved on, but COVID is not. Get vaccinated, get boosted, stay up to date.
I like it a lot. I like the title. It catches attention, and it's like an awareness.
Mhm.
I see the pictures behind that woman standing. So that's nice. Just a bunch of pictures of happy people.
That's true. Everyone's happy in this flyer.
No.
I just don't understand why they added that woman there.
Well, there's more to
I-
come. We'll show you.
She's yeah, I think she's trying to, like, you know, they put her to, because it pops up like she's, I think her picture makes it like, okay, like pay attention, I'm saying something, you know, like there is words. I like the wording on top a lot. That's what caught my, you know, my eye. Like
Mhm.
these kind of things, like the comments, or like what do they call them, like the wordings that people want to hear. So like I think this is really good.
I think it
They also have a number too.
very simple and it touches
Yeah.
that.
Well, good. Because this is our current grant campaign.
Oh, shoot.
So, so there is actually messaging out there, you know, we're wrapping up this grant, so this is slowly ramping down, but this is the clear messaging that we're trying to put out, and we'll show you in a few slides that there's multiple languages and whatnot. All right, Maya, I took over. Go ahead.
You're fine. So we're going to be talking about when using health materials. So don't assume that your patients can read those materials. When reviewing the handout, a couple different things to do are circling and highlighting the most important points for your client, to personalize the material by adding their name or the medications. Using the teach back method to confirm their understanding, which we're going to talk about a little bit in just a few slides. And then emphasize the importance of keeping the material so you can refer to it when doing follow-up with that patient. And then make sure the patient has internet access when recommending digital materials, as we have talked about.
Oh.
And then obtaining the feedback on the materials as well. So figuring out exactly what the patients think about the materials that you're giving to them, so you can better change, adjust materials that you're giving out to suit your population.
All right, so the second one was evaluating or using effective health education materials. So, when you meet with your clients, pay attention to what you're presenting them with, right? Have you heard, has either of you heard about Teach Back or Learn Teach Back as a formal method?
I think I've heard of it before, maybe. Sounds familiar.
Yeah. So let's go into
I
it.
haven't really
Oh, go ahead.
that much.
It's probably something you're already doing, but
Is
you
this is that a way of just like making the patient understand the information?
Yep.
Um,
Yep. So let's
you know,
do,
like repeating it,
yep. Well,
and
it can
help
be.
them understand it.
Yep. All right. So we know that a lot of people forget what they hear at the doctor's office, or they hear incorrectly. So Teach Back is a method to improve that. And just like you said, it's basically teaching the patient about their condition or their management, whatever they need to do, but then checking back and saying, okay, tell me what I just said. How are you going to take care of your diabetes? It's a way to make sure that they understood what you were saying. It's not meant to be like a quiz or a test of patience. It's just a method, right? To make, and you always say, I need to make sure I explain this clearly. Can you please tell me da 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 da, right? So it is important. It helps patients remember information correctly and keep to their treatment plan, adherence, decrease cancellations, callbacks, and improve outcomes. So some of the elements for effective teach back, they are just the same. We're going to talk about this over and over and over and over in this whole session, but using a caring voice, being warm and open, displaying comfortable body language, appropriate eye contact, using that plain language, like I said, and using reader-friendly print materials. Typically, we use non-shaming, open-ended questions. Simply asking yes or no is not a good. So this is kind of interesting. We talked a little bit about the red flags. Remember, we talked about the sense of shame. We talked about people asking fewer questions. A lot of times, if a person has lower health literacy, they don't want to admit that. And so you might, if you ask them a yes or no question, they can just say yes. Did you understand all that? Yes. Did they really understand? That's why we have to use these techniques to make sure. So again, if you're like, let's say, you're part of the care team and the doctor saw the patient, you're going back in and you're going to teach them about their conditions and what they need to do. It's best to only teach about one topic at a time, right? To chunk it. So if a person has diabetes, COPD, and CHF, you're not going to go through all three at once. You're going to chunk it up, right, into easier sections. And you basically are going to teach the patient what they need to do. And then you ask them, how are you going to do it? If they're not able to answer that, then you might need to teach back in a different way. Maybe you draw a picture, maybe you use, a different handout. But the point is to just have them confirm back. Okay, so what we're going to do now is a quick role playing. We have a teach back example, and this example, you guys are going to laugh. So the first example is a non-health literate. So imagine I'm a infectious disease doctor and I walk in and Maya's the patient and she has COVID and this is what I'm gonna say to her. All right. Mrs. Thompson, you have COVID. I'm prescribing Paxlovid, the antiviral medication authorized by the FDA to prevent severe COVID symptoms in people at higher risk. Paxlovid has 2 antiviral medications in it, 300 milligrams of nirmatrelvir and 100 milligrams of ritonavir. They exert antiviral efficiency by inhibiting a necessary protease in the viral replication procedure. You'll need to take each dose twice daily for 5 days. You need to use barrier protection when having intercourse for the remainder of your oral contraceptive pack. Serious side effects include allergic reaction. You may have angioedema of your mouth and tongue, skin rash, hives, blistering, or trouble swallowing or breathing. Also liver damage, so look out for hepatomegaly, jaundice, and pruritus. Okay, do you have any questions? You're like, what?
That just scares the person.
The fact
Okay,
that you said
no
All the
questions.
side effects.
the fact that you said what's in it, like who's gonna understand what that is? Like the medication part.
So I'll see you back here in 2 weeks for a recheck. I hope you feel better. So this is someone who has no like awareness, right, of what they're
It
saying.
sounds like a commercial. Literally.
It is kind of a commercial. Okay, so let's do another example. Now imagine in this example, the same scenario, Mrs. Thompson has COVID. We are going to prescribe Paxlovid, but we're using a handout now. So imagine the next few slides are an actual handout. And this is the actual handout. So you guys know if you ever are going to need to prescribe Paxlovid. Mrs. Thompson, as you know, your COPD and diabetes put you at a higher risk for developing severe COVID-19. I'm going to prescribe you the antiviral pill called Paxlovid. This is what a dose of Paxlovid looks like. There's 2 pink pills and white pill in each packet. You have to take the whole packet twice a day for 5 days total. Here is some additional information about taking Paxlovid. I've highlighted the most important things like taking the pills whole. And here's some medications that you should not take if you're taking Paxlovid. Are you taking any of these medications currently? Okay. Because you do take the birth control pill, I have to let you know that Paxlovid can cause it not to work. So if you do have sex the rest of the cycle, you need to make sure you use a condom or another protection. All right, here are some side effects to look out for. The most important thing is liver problems. Some of the things you might notice are your eyes or skin turning yellow or getting really itchy or pain in your stomach. If you have any of these symptoms, please call the office right away. And these are some other side effects that are very common and they usually only last a few days. All right, so Ms. Thompson, I'd like to make sure I explained everything clearly to you. Can you please tell me how you're going to take Paxlovid and what to look out for?
So each pill packet has 3 pills. I need to take 1 packet 2 times a day for 5 days and avoid these other medications. I can't remember what side effect to look out for.
Liver problems is the big thing.
That's right. I'll notice if my skin or eyes are turning yellow and my skin gets really itchy, and if my urine gets dark. Will do, doctor.
Okay. So do you see the difference between the two? Oops. Now with that example with Teach Back, you can see that the most important thing is how to take the medication and what to look out for. And that's kind of what's been highlighted. Any questions?
I think how you explained it the second time is way better.
Right.
Yeah, it just the first time you just, the main points you were just talking about like the side effects. But the second time, you were more slower and you just told them what to watch out for. Instead of just saying, it can cause this and it can cause that, and, that's just scaring the patient.
Mm-hmm. Absolutely.
Do you notice how she didn't use do you understand what I'm saying? Where they just say yes. It was like she made sure I understood what the instructions
Yeah,
were.
and she did, she asked if you understood it instead of, you know, just
I asked
leaving
her
the
to tell me.
patient
Mhm.
confused.
Yep.
So, yep, that I really liked how you explained it.
Yep. So when you're teaching, slow down, use plain language,
Yeah.
and use handouts. No, I'm just kidding. But that is important. All right, we have two more that we're going to get through, and then we're going to talk. This is a quick one, and then we're going to take a quick break. The fourth health literacy strategy we're going to talk about is not really one of the targeted ones for the grant. So for the grant, we're talking to you about communication, health materials, teach back method, looking at culture and linguistic considerations and motivational interviewing. This is the one that is small steps to health is about behavior change and setting goals with your clients or patients. So we were so lucky we got to do this project in the laundromat with Authority Health, and we were teaching about health literacy in the laundromat. This was another part of that project. And so when we talk about small steps to health, we're talking about making sure that you set goals that with your patients that they can achieve. And I know we talk a lot about the SMART goals, right? Specific, measurable, achievable, realistic, timely. But really, what are you able to do? So let me give you an example. In medicine, we recommend 150 minutes of cardiovascular activity a week. Okay. So I have had some doctors, I've heard doctors I've trained say, okay, you need to get 150 minutes of exercise every week. And the patient's like, what? Like, how do I do that? Like, what do you mean? So instead of saying that, what about saying like, what are some ways to increase activity? Do you think you could, put on a video on YouTube and dance in your kitchen? Can you do chair aerobics? There's different things. So really working with that person to set a small attainable goal to work on rather than just trying to give them like all of it at once. Does that make sense?
Yeah, I actually had my doctor one time wanted me to go on this diet, and he knows that I would never do diets because they never work with me. So he gave me like this strategy where it was funny. It was like just a part of your day, do 20 minutes, like just go walk around the block or go to the park, just 20 minutes and come back. Or like he did something so like nice for me, like a whole schedule of how to work on it, and it actually helped me. So like these little small things help without him just throwing, okay, go on a diet, you have to lose this amount of weight. He gave me something to help me with it.
Go
I
ahead.
think the word I think the word, like how you said, the word diet just scares people.
Yeah.
Yeah.
Yeah, they just don't work.
I think they should use like another word. Like I
Yeah.
don't know, they should explain, just like better eating or if more movement throughout the day, but they shouldn't use the word diet.
Yeah.
Because when someone hears diet, they just think like, oh my gosh, like I can't eat this, I can't eat that, and they think like there's good foods and bad foods, but it's all about like moderation. So I just hate that term when someone uses diet, and I hate when someone uses like bad foods and good foods.
I agree. There's a lot of things around, well, the way we talk about things that influence
Yeah,
how we think about things, right?
exactly.
In the past, I was presenting with a different co-presenter, and she was on a weight loss journey, and she lost a lot of weight, like 100+ pounds. And the way she described doing it was every day when Law and Order came on, that was her show. She loved Law and Order. She would just walk in place while she was watching TV. And that was just her small step. And, we showed this to say, at the time when she's standing in front of the TV, she's not feeling like that's doing much. But, after you lose 120 pounds, that what you're doing is leading to this big improvement. So just continuing to think about what are goals that, we can attain, how can I work with my client to come up with a plan, right, of a behavior. So small steps to health is one of our it is evidence-based, but it's not one that we necessarily are promoting for this grant, but please remember. All right, we have one more intervention. Maya's gonna start us out, and then we're gonna take a quick break and wrap up with motivational interviewing.
So this intervention is making sure that we're considering language and culture of the people we're interacting with. So Wayne County, as most of you guys know, has a mixed of populations with different languages and cultural beliefs. So we're going to review CLASS, which is culturally and linguistically appropriate services. So it is a framework to deliver different healthcare services. It's making sure that we're respectful and responsive to different cultural beliefs, preferences, and communication needs of the patients. It's used to promote health equity and reduce those disparities that we talked about previously. So a couple of those themes are principal standards, governance, leadership and workforce, communication and language, and then engagement, continuous improvement, and accountability. So a couple different strategies to implement this. Some language related strategies are assessing language preferences and language assistance needs, using acceptable language services. We're going to talk a little bit more about that. Planning for an interpreter services in advance, and then providing written materials in those patients' preferred languages.
How many of these are you already doing at Access?
I did have a Mexican client once, and she only spoke Spanish. So I used an interpreter on the phone to help her out with the insurance, and just so she can understand me, because all I spoke was English. So
All right,
that really helped, like using that resource.
yeah, we definitely recommend
Yeah.
hiring for translation needs.
Yeah, Access also provides all different kind of languages for the clients to for their which language they prefer.
Mhm.
We usually put them, like, I had a case where one of the clients only spoke Pashto, and I only speak the English, and then I had an interpreter where I scheduled an appointment with him during his appointment time, and the whole time he was with us over the phone, and he helped him and explained everything to him.
Mhm. Very cool.
Okay, so a couple different strategies that are more culturally related to implement CLASS. Making sure we're respectfully asking patients about their health beliefs and their customs, avoiding that stereotyping based on religious or cultural backgrounds, and acknowledging and addressing implicit bias. So the language translation services do's and don'ts. I'm going to start with the don't use. We're going to kind of address a little bit like the patient's family and friends portion. So we're not going to want to use clinicians or staffs who are not trained or certified as medical interpreters. This is making sure that nothing is getting improperly translated. So we're not wanting to use patient's family and friends. A lot of times patients aren't comfortable with using somebody other than family and friends. So it's not always possible. But it does pose a problem with patient privacy. And if the client insists, we want to respect their choice, but still have a qualified interpreter present. And minors also should not be used as well. So instead, we want to try to use the bilingual clinicians or staff members who have their proficiency for medical terminology has been confirmed. Staff who are trained as interpreters on-site trained medical interpreters, or telephone or video medical interpreter services, which obviously sounds like you guys are already using there. So this is a resource that is amazing. It was developed by U of M, and they have a ton of different healthcare or health education promotional materials in all of these different languages. So it is translated as the same exact materials, but all in different languages that are listed there. I'm not sure if Dr. C, if you want to say anything.
Of course,
else
I'm going to
about
say
this.
something. Just kidding. They have more than just these diseases and conditions as well. If you're looking for materials, I recommend you look at this website. They took a lot of time and work in putting this together. These are some COVID ones from earlier. here's the ones that we wanted to show you. So these are the ones that are out currently for this grant.
I like those.
You like them?
Mm-hmm.
I really like the pictures like in the back.
The happy people?
Yeah.
I
Like
guess they
catches
all
your
have
eye.
happy, yeah.
Yeah, I like them. I love how the just so different languages.
Mhm,
And it's like it's very simple. It's not doing
Yep.
too much.
mhm.
Yep.
All right. So language, cultural competency is the other part of this. And so we're going to talk a little bit about that. And so religion, culture, beliefs, ethnic customs can influence how patients engage with the healthcare system and how they make decisions about their health. So having cultural competence relies on the principles of trust, respect for diversity, equity, fairness, social justice, all the things that we've kind of been talking about throughout this session. And what is it? It's a set of attitudes, behaviors, and policies that allow us to work effectively in cross-cultural situations. So I'm sure you're aware of some of this, but there's different ways that culture can influence health engagement. And so we kind of want to just go through a few examples of those. Health beliefs. Some cultures, people believe that talking about a possible poor health outcome might actually cause that to occur. So, for example, they may not want to talk about breast cancer, mammogram screening, etc. That could be, something that they're not comfortable talking about. Customs. In some cultures, family members play a large role in the healthcare decision. Ethnic customs, sometimes roles of women and men may determine who makes decisions. Religious beliefs, there are different religious faiths and spiritual beliefs that could impact if someone accepts certain treatments. Dietary, our favorite word, dietary customs. One of my biggest pet peeves in Detroit is we always try to promote the same diet. If we have to know our patient, right? We have to know about them. We have to know what their dietary customs are, because I'm telling you what, as doctors, we recommend these changes to change the way you eat, but we're not thinking about, does the person know how to cook this kind of food, or are they cooking different kind of food? So, really just being mindful
Yeah,
about.
exactly. And you have to know like their medical history. Like
Yeah,
someone diabetic is not gonna eat the same as someone who is not diabetic, you know?
absolutely.
That's true.
I don't know if this exists yet or not, but something I've been talking about for a while is just coming up with diet plans, but using cultural food. So different culture have different diet plans. So you're not trying to
Oh,
fit in.
yeah, that's very nice actually.
Yeah.
Yeah, because we usually when they do like those meal plans, it's usually like the same food basically.
Mhm. Mhm.
We never consider like the cultural foods.
Mhm. We should. Okay. Interpersonal customs, different cultures may have different ways of thinking about eye contact or physical touch. So just knowing who you're working with, right? Implicit bias. So we all grow up and develop something that we call our worldview. We live in our families, in our communities, in our churches, and whatnot, and we develop our belief system. That's what we call. And sometimes that belief system has bias. So something we need to do is take a look inside and understand if you have bias or not. Understanding your own beliefs, values, customs allows you to become more understanding and respectful of others. And remember, your life experience is a point of reference, right? To compare to and learn from. It's not better than other. We're not better than each other. We're different, and we need to learn from each other. And as healthcare or community champions, it's our job to reflect, right? And make sure that our bias doesn't impact how we communicate with others or how we treat people. So this is something really important. This is the part of the lecture where I start to say things like, we're going to talk about some stuff on each one of these slides, and I encourage you to continue and follow up if you need more information, because each one of these slides coming up can be a whole lecture. It can be a whole session. It could be a whole series. So please follow up in your own, exploration. Harvard has, I'm not even gonna recommend this, but there is a link here if you are interested in the Harvard implicit bias test, which can be fun. It's more of an experiment. All right, patient-centered awareness or person-centered awareness strategies. So we want to make sure when we're working with our clients or patients that we're forming a partnership with them. And that we're not, again, thinking, okay, my way is the way, your way doesn't matter. It's a partnership and a joint decision making. So what can we do as providers? Just continually remember that different things like race, ethnicity, gender, spirituality all play a role in how we perceive healthcare and how we understand healthcare. It's so important that we all understand our communities. So what our community is made of, different populations, languages, etc. Talking to people, understanding their beliefs and backgrounds. Developing cultural humility, of course. Do not think your way is the best. Be respectful. That will take you far. Being respectful will take you far, far away. And of course, study if you have time. I put a link in here. There's a lot of stuff about cultural competency in treating populations. This is silly, but empathy and open-mindedness, right? So just try to keep an open mind and have empathy. Have either of you heard of this book, The Body Keeps the Score?
No, I did not.
Okay. So this goes in a little bit more into trauma-informed service, but The Body Keeps the Score is a really good book. I recommend that everyone reads it. And it talks about how trauma impacts health. And have you ever heard of toxic stress or adverse childhood experiences, or ACEs?
To be honest, I haven't.
Okay, that's fair. I would definitely, do some follow-up research. So without getting totally into it, there are things, adversity in childhood, different things that can happen in childhood, or even in adulthood, where your stress level, that fight or flight feeling that you have gets too high and it stays high, and that's toxic. And we understand that high level of it's actually cortisol, if we want to be specific, can damage the body and impact health both physically and mentally. So we bring this up. There's a couple slides to think about. Maslow's hierarchy of needs. How about this one? Have either of you seen this? I just throw things in all over.
I have actually.
Okay.
In one of my classes.
Okay.
When I was back in school. Yeah.
So basically this is just a reminder when you're talking to someone, a patient in front of you, you may have an idea, oh, we're going to get you into, mental health counseling. We're going to get you in and you're going to feel better. But if you don't assess the basic needs first, we're not going to get anywhere. So really just thinking, is the person before me, do they have all their basic needs met before I try to get them to engage in a healthcare program or a different diet or whatnot? Do they have food to eat? Do they have a place to sleep tonight? Because those things have to be met first before we can talk about anything else.
I just wanted to say something real fast. I'm sorry. So Alia's computer completely turned off, but she is sitting next to me.
Okay.
Yeah, I'm right here, so
Okay, no problem.
I'm still listening to what you're saying.
Okay, no problem. The pair of ACEs. So if you're interested, you can look into the pair of ACEs. This was a model. This is based on building community resilience. So putting systems in place to protect our communities. And we talked, and I just mentioned adverse childhood experiences. The whole point of this slide is looking at the community environment. What does our community environment look like? Do we have a community environment where we're promoting health and allowing people to have health and be healthy? Or are there issues with housing, water, all these things play into health. We're going to skip that one. So this is our last slide before a quick break. Creating a trauma-informed space. I've asked these questions to students in the past. And this kind of relates to cultural competency. So we're going to go through these questions and take a break. Have you considered the trauma this person experienced? You could say the same thing. Have you considered the culture or the beliefs or the language, right, of this person? Are you creating a safe place for the person to share, right? Do you have any unconscious or conscious bias to consider, or can you even be unbiased? There are people that have very strong biases, right? Probably not. Some of them are working in healthcare, and it's something we have to break down those biases. How does your background, history, etc., impact your ability to serve the person? Are your actions making people uncomfortable? Are the words you're using respectful and culturally appropriate? And are you actively listening? At the end of the day, are you actively listening, or are you just talking or listening to talk? So just kind of some of the things that we talk about when you're practicing culturally competent trauma-informed care. Any questions? That's a lot.
No, I think we're good.
Okay, let's just get up and stretch our legs. We're running a little late, but we're gonna be okay. I will pause for a few minutes and then let's get started again at 2:30.
Okay, that sounds good.
Okay.
Thank you
Thank you.
so much.
Yeah. Okay, now how do I do this? Okay.
Alrighty, so we're going to be talking about some strategies to overcome vaccine hesitancy and COVID-19 vaccine hesitancy. So, vaccine hesitancy is defined as a delay in acceptance or a refusal of vaccines despite availability of those services. And it's one of the top threats to global health. And there's very few effective strategies to address this growing problem. So a couple of causes of vaccine hesitancy are healthcare and socioeconomic inequalities and inequities. There's a lack of effective public health messaging, unethical research involving ethnic minority groups, and structural racism. There's social disadvantages, lower level of education, and access to high quality, accurate information. There's a growing spread of misinformation and disinformation. So there's a difference between mis and disinformation. And then conspiracy theories through online platforms. And then there's barriers to access, including vaccine delivery time, location, and cost related to socioeconomic inequalities and marginalization.
Okay, so I don't know, I'll take over. So if you guys are interested, you can look at the CDC, this link right here. They did come out with a guide to increase COVID vaccination. It does, these strategies are good for any type of vaccination or really primary care. So the two that we'll cover are motivational interviewing and then combating misinformation. Have either of you learned about motivational interviewing at all?
Not really.
Okay, motivational interviewing goes along with that small step behavior change that we kind of talked about. It's a method of literally being with people that allows them to kind of talk about their motivations. So let's quickly go through it. It takes a lot of like practice to do this. So again, like I said 1,000 times, if you're interested, please seek more information on this method because it is a great method. So basically, it's a way to communicate. It helps us kind of help the patient understand their motivations and maybe even create some behavior change. That's what our whole purposes of doing this. So it's based on being respectful and curious with people. We talk about the spirit of motivational interviewing, and it's along the same lines of what we've been talking about. Kind of the traditional, or maybe in the past, or still in some places, the way medicine is kind of done is this authoritative way, right? So I'm the doctor, I know everything, you're the patient, you need to learn because you don't know what you're doing. Otherwise you'd be healthy. That's kind of the traditional way of medicine. Like, I'm going to teach you because you don't know. Motivational interviewing is more of a collaboration. So you're working with the person to kind of talk through the situation and understand, you know, what they want out of the situation. So we're going to go into a little bit more information. One of the models for motivational interviewing is called OARS, and it's open-ended questions, affirmations, reflections, and summary. And so there's 4 steps in the process. So let's say you're sitting down in front of one of your patients and you're talking. The first thing is asking an open-ended question. We talked about questions that are like, did you understand, or do you do this? Those are yes or no type questions, and they don't give us very much information. But how about if we said, hey, tell me more about how you feel about the vaccine, right? Or tell me more about getting healthy for this 5K or whatever it is, right? That you're talking to them about. So while you're asking open-ended questions, while they're talking and telling you the information, you want to provide affirmations, and you want to just sincerely say, wow, it sounds like, you went through a lot, or it took a lot of strength to do that. Things like that, encouraging them and kind of highlighting strength. Reflections are like reflecting back, right? Like a mirror. So looking and listening to what they say and using their own language. So, you can, as they're talking, if they come to a point, you can say, okay, let me make sure I understand what you're saying. It sounds like what you're saying is this. Can you clarify for me, or whatnot? So these are just ways to make sure that we're understanding and that they know that we're actively listening to them. And then summarize. So at the end of this conversation, you can pull together, okay, so this is what I heard you say. You want to change the way your activity, but you're worried about such and such, right? Or whatever it is. So you can kind of summarize and bring it all back together and make sure that you heard them correctly. So this is a technique. Some of the strategies about vaccine and COVID specifically: do not assume vaccine acceptance, right? So don't go into it thinking that the person feels a certain way about the vaccine. Keeping it open-ended, acknowledging their concerns without judging, right? Just having empathy. Avoid criticizing their information sources. People have heard things from their family, their elders, sometimes church people. You don't want to say, oh, that's dumb, or you don't want to criticize. You just want to provide factual information. Don't judge. Showing your awareness, community health workers, education, all the things that we're doing in the community. We're messengers. You're messengers. You are carrying a message of health, right? So it matters what you're doing. Understand that. And then finally, linking the vaccine acceptance to the patient's hopes and goals. So this is probably a little more applicable back in the day, but remember when none of the grandparents could see their grandkids, we were all separated from our grand family. For example, let's say you're with a grandma and she really wants to see her grandkids soon. Well, you could say something like, oh, well, getting this vaccine will help you get to your goal of seeing your grandkids. So it helps them. You're looking for reasons to motivate them that they've already kind of stated. All right, so that's a big overview. It's a huge of motivational interviewing. And Maya and I will do a role play, and hopefully you'll be able to kind of see the difference between the traditional and the motivational interviewing approach. So first, we're going to do a scenario. Imagine I'm the doctor, she's the patient, she's a mom, and we're talking about vaccines in the office. So the first approach is traditional. So I know everything, right? I'm right. All right. Ms. Thompson, it's important to immunize your child. If not, you're putting him in danger. Do you know there's still cases of measles in the United States? This disease could be very dangerous. And what about meningitis? It could be fatal, You should update your child's vaccinations, as he's already late according to the schedule. We can do that now if you want.
I don't see the urgency, and autism is worse than measles. There are more problems than solutions with this vaccine. It's completely unbelievable to give so many vaccines at the same time.
Studies have demonstrated there is no link between autism and the measles vaccine. The vaccine is safe, I assure you. You should be aware of the information you're finding on the internet. Giving several vaccines is not associated with more pain and is safe. We should do that now.
I've heard something else, and not only on the internet. I've read a lot, and vaccine is not mandatory. I can do what I want.
Yes, you're right. It's not mandatory, but you're putting him and other children who cannot receive vaccines in danger. The risk of disease is much higher than the risk of the vaccine. If I'm taking my time out of my day to speak with you, it's because this is very important.
It's easy for you, quick, but what if he gets autism? I'm worried about the risk of the vaccine, but you don't seem to be worried about the health of my child.
Of course I am, and I'm worried about the fact he can get diseases that could be prevented by vaccines.
I don't think we understand each other. Let's talk about this one another time.
Okay, so in our first example, I was just, he needs the vaccine, he needs the vaccine. Don't think about, don't listen to the internet, right? And she didn't want the vaccine. It ended up that she was opposed, right? So let's try the motivational interviewing approach. All right. Hello, Mrs. Thompson. What do you think about the advantages of vaccination?
Well, I know that vaccines protect children against several diseases that we don't want to see anymore, or that we don't see anymore. My child received all of his first vaccines, but I'm worried that the measles vaccine could cause autism. For other vaccines, I have fewer doubts, but I'm still hesitating.
As you said, vaccines have reduced diseases in such an important way that they are now much less frequent. It's why you vaccinated your child when he was a baby. If I understood you correctly, with the exception of the measles vaccine, other vaccines seem safe to you?
Yes, I know it's a good thing to prevent those infections, but about measles, I'm conflicted. I've read a lot of books and articles. Lots of people are worried about the link between the measles vaccine and autism.
So you find that it's important to protect your child against diseases when the vaccines are safe, but you're worried about what you've heard regarding autism and measles vaccine. I see you've done a lot of research about the subject. If you'd like, I can give you some additional information about the studies between autism and measles.
Sure, I want to know exactly what happened.
Well, in fact, you're right. One study had hypothesized a link between the measles vaccine and autism, but this study was fake and the author lost his medical license. More than 500 studies have been done since then and have demonstrated there's no link between the vaccine and autism. The frequency of autism is the same in a vaccinated group of children and in a non-vaccinated group of children. So what do you think?
So I'm not crazy to be worried about that?
Of course not. You're totally right.
Thank you for taking the time to understand my concerns. I think it's a little bit clearer now.
Okay.
Mixed up there at the end.
Okay. Okay. So in this example, do you guys see the difference? What do you notice?
So obviously the first one was the doctor was too pushy, I would say. Even though like he's not respecting the parents but decisions and thoughts. But the second approach was amazing because the doctor gave his point of view and then the parent gave their point of view. And I love how it ended where he'll give her, some type of resources or stuff like that to search,
educate them about it
Mhm.
instead of just like pushing them to do it and feeling and the patient didn't feel like forced
Yep.
to give the vaccine.
Yes. Yep. So those are all the reasons why we use motivational interviewing.
Yeah.
Okay. Awesome. All right, we're wrapping it up. Does anyone besides Maya know the difference between misinformation and disinformation? Do you have any idea?
Misinformation. Maybe like I want to say giving the patient the wrong information is my guess.
Okay. So they're both wrong, right? So misinformation is, go ahead.
Is it like misinformation, like inaccurate information?
So the main difference between,
And like what she said, disinformation's not sure, honestly.
it's okay.
Like intentionally, like
Yes.
giving them the wrong information.
Yes. That's the difference. So misinformation can be shared. It's not correct, right? It's not accurate, but the person sharing it doesn't realize that. Disinformation is the intentional sharing of false information to try to change perception. So with that all being said, Social media. So this is the social media landscape. The reason why I show this is just to, once again, we all realize there's so many different places that people get their information, right? And these are all the electronic ones, it looks like, but there's even more than this. So, this is not really one of the evidence-based things, but we're going to talk about a few quick strategies. So like we said before with vaccines, rather than, excuse me, arguing or judging the information, even if it's something you think is crazy, you're like, what? You're not going to grow a third eye. Can't judge it. You just have to be, empathetic and provide factual information. So don't argue, just provide factual information. Use your credible sources to demonstrate facts. So make sure that, you're using the CDC or the MDHHS or whatnot. Using trusted messengers. Like I said, you guys are community health workers. You are the messengers. But things like celebrities or church leaders or, faith-based neighborhood champions. This is a good way. Having these people promote things, right, that are so we can make sure that the information is clear. We're not going to do a quiz, but I am going to talk to you a little bit about the vaccines because this grant is about COVID. So let's review quickly. You guys remember in the beginning, there was the primary series, and it was the monovalent, and that was the Delta strain. That was the original strain that was covered. And then after that, they had, remember, the Omicron variant came out and was spreading. So the bivalent, which was the second shot that came out, covered the Delta and these new Omicron variants, BA4 and 5. So those are the past vaccines that we probably got. Did you guys get them?
I only got I got the first dose and then I got the booster.
Okay.
I got the booster too.
Yeah.
Yeah.
Okay. So now we have these are the new, we're not even calling them boosters. We're just saying these are the vaccines. So the other ones that I showed you, no longer, this is it. So these are the vaccines. This is Moderna and this is Moderna and this is Pfizer. And basically it's basically one dose. Like if you need to get it vaccinated, you go in, you get one dose of these. There are different subgroups with different schedules. And there is some protection. If you really care, you can go look into these variants and track them, but if not, so that's what is currently. Now, are you providing vaccines at Access or no?
In the clinic they do, yeah.
Okay.
Yeah.
Okay, great. And you have the COVID vaccine?
I'm sure they
Yeah,
do.
we do.
Yeah.
Okay. And we're not going to talk about this. They don't track this data anymore, but for a time they did, and this is just showing the unvaccinated versus the vaccinated versus the boosted. And this is the deaths. So we're not trying to say anything. We're just showing this is the data. And then the people who actually contracted COVID. So we do have some evidence that our vaccine and booster work are effective. Most effective against preventing severe disease, right? Hospitalization and death. And we're not going through this. Okay, we don't have much time left, but if we want to have like 1 minute to discuss this, did either of you have a situation where someone refused to get vaccinated because something they had heard?
Actually, I had a family member, yes.
Oh,
That
okay.
he thought that they have a device in the vaccine, and he said, nope, they're gonna track me. I don't want it.
Mhm.
So he never took it. Until this day, he's very against it. He did get COVID though, and it hit him really bad.
Oh,
Yeah, but he's just convinced that there's something in there that he's gonna get tracked, and because he heard it over like TV or social media or something, and it stuck to him.
yeah,
So yeah.
yeah. It's a great
My
example.
brother actually, my younger brother. I don't know. He kept seeing on the news that it caused what do you call it? Bell's palsy.
What is it?
The weakness in the face.
Oh, the Bell's palsy, yeah.
Yeah, Bell's palsy. So he just got scared to take it. Actually, he's never gotten any of the vaccines.
Okay. Yeah, I heard a bunch of people talked about a microchip. I mean, we heard a lot about superpowers. All sorts of things. Superpowers.
Oh my god.
That's a good one. I would take it again.
I've heard, yeah, like the government is just putting a tracking device.
Yeah, that's what
in it to track you.
Yeah.
All right. All right. So we're at the end of our session. I'm gonna have Maya kind of wrap us up.
Yeah, so a couple of the key takeaways of stuff that we went over today. Looking at a low health literacy, it's associated with lower health knowledge, poor medication adherence, increase of emergency resources for primary care, and increased mortality rates, and all of which impact quality of life of people. So all of these are impacts of low health literacy. It's important to remember the universal precautions and assume all patients have a low health literacy level. And then improving individual and community health literacy levels can reduce vaccine hesitancy and increase those COVID-19 vaccination rates. And then a final review, we talked about that 5th to 6th grade reading level to make sure the level of health education material that we're putting out is the most inclusive that it can be. Health literacy strategies can be used to increase patients' understanding about their health condition, and it empowers them to take an active role in their own health. So making sure that we are having clear communication, using that teach back method, using culturally and linguistically appropriate materials, using motivational interviewing, and combating that misinformation.
All right. So what we're going to do now is wrap up. We'll come back to this. There is a training. If you want more information, you can do this training, and there's resources at the end of these slides. I will send out the slide deck and a one-pager on the health literacy interventions that we talked about for you to review, as well as the link. At this time, you are free. We thank you for coming. If you are available to grab your phone and do this post-session evaluation, we would appreciate it, but if not, that's okay. At the end of the evaluation, you'll see there's a section where if you provide your name, your address, your date of birth, whatnot, you can get a certificate of completion from Wayne County Community College District. So you'll see that if you choose to do the evaluation. So with that,
Thank you guys so